Hello friends, welcome back to my YouTube channel, that is ENT Chronicle, and topic of discussion for today is rhinitis. Rhinitis is a very important topic and we will cover every single of these things in great detail. Okay, so rhinitis is divided into two parts. First we have acute rhinitis and we also have something known as chronic rhinitis. So chronic rhinitis is further of 5 types. First is chronic simple rhinitis, hypertrophic rhinitis, and most important one of them all is atrophic rhinitis. We have something known as rhinitis sicca and rhinitis caseosa. So all these 5 types are examples of chronic rhinitis. Acute rhinitis on the basis of etiology is of 3 types. First we have viral rhinitis, because of viral causes, and we have bacterial rhinitis of bacterial causes, and finally we also have something known as the irritative rhinitis due to dust, mites and pollens. So viral rhinitis is of further 3 types. We have something known as the coryza, the common cold. We have influenza rhinitis and rhinitis in exanthemas infections. In bacterial rhinitis, we have diphtheritic rhinitis caused due to infection of Corynebacterium diphtheria. Then we have some non-specific infection occurring due to infection by organism like Staphylococcus, Streptococcus and Haemophilus bacteria. So these are included in the non-specific infections. So let's start with acute rhinitis first. And in acute rhinitis, we will first start with viral rhinitis. Okay, let's start with common cold. So common cold is also referred to as coryza. Etiology of common cold is viral. So common cold is of viral etiology. And what are the agents, viral agents, which are leads to causation of common cold? Those are rhinovirus, coronavirus, influenza and parainfluenza viruses. We have respiratory syncytial virus, and finally we have adenovirus. So all these are included in the agents of which causes common cold. So how is the common cold transmitted? So the transmission of common cold occurs by droplet infection. All right, by droplet infections. Now let's discuss about the pathology. What exactly happens because of which signs and symptoms in common cold occur? Initially, there is, as soon as the virus attacks the human body, there is initially vasoconstriction in the nasal cavity. This vasoconstriction decreases the perfusion of nose, and because of this decreased perfusion, there is dryness of nose. And after initial vasoconstriction, there is reflex vasodilation in the nasal cavity. Now this reflex vasodilation leads to engorgement of vessels, that is filling of vessels with blood, and this leads to mucosal edema, and finally mucosal edema leads to hypersecretory nasal structure, because of which we get something known as the runny nose. Alright, due to increased secretion. So what happens is, there is initially vasoconstriction, then we have reflex vasodilation, and finally this reflex vasodilation leads to excessive secretion, mucosal edema and engorgement of vessels. Alright, let's move ahead. The clinical features of coryza or common cold are divided into 4 stages. First, we have the stage of ischemia, in which what we see is dryness and itching. We have already explained why does it happen. It is because of initial vasoconstriction. All right. Next stage is of reactive stage. In this, there is reflex increase in ciliary action, and we also see something known as the dry cough. Next stage is, the third stage in coryza is stage of ciliary paralysis. So this is hyperexcitatory stage. In the next stage, there is ciliary paralysis. And because of this ciliary paralysis, there is very much increased chances of secondary bacterial infection, and also there is venous stasis, since we have occurred on the stage of vasodilation. Next, we have stage of resolution. like any other viral infection, common cold is also resolving. So the cilia regains its action back and the patient reverts back normal. But sometimes there are few complications in coryza. Complications, although are very rare, but may happen if the person is not treated for the very long time. So first we have something known as the pharyngitis. The patient might as well experience sinusitis, tonsillitis, otitis media, and as lymphadenitis as well. So these are the complications of coryza. So let's move ahead to treatment. So since it's a viral infection, the treatment is symptomatic. First, we will suggest bed rest to the patient. We will give nasal decongestant to the patient and analgesics and antipyretics according to the signs and symptoms of the patient. But in these three cases, that is, first is mucopurulent discharge. If we see mucopurulent discharge, if there is stridor in the children, and if a children less than 2 years of age presents with high grade fever, in all these three conditions, 1, 2, 3, we give antibiotic to the patient. Antibiotics are otherwise not necessary, but in these three cases, that is mucopurulent discharge, stridor in children, and high grade fever, children presenting with high grade fever, we provide the patient with antibiotics. Alright, otherwise symptomatic management is enough. Okay, let's move on to the next topic, that is influenza rhinitis. So influenza rhinitis, the causative agents, as the name suggests, is influenza. All three types, that is type A, B, and C, causes influenza rhinitis. Influenza rhinitis is very common in children as well as in the elderly. So let's talk about the pathology of influenza rhinitis. Influenza viruses type A, B, and C causes extensive necrosis, especially of the ciliated epithelium. Therefore, if there is not going to be any cilia in the nasal cavity, there would be increased chance of secondary bacterial infection. So the most dangerous thing in influenza rhinitis is secondary bacterial infection only. Now, clinical features of influenza rhinitis are much more severe than common cold. The general symptoms include fever, malaise, joint pain, and specific nasal symptoms include runny nose and nasal obstruction. One thing to remember here is that in children, influenza rhinitis causes acute nasal obstruction. That is, nasal obstruction in children due to influenza rhinitis is acute and has to be dealt with emergency. What are the complications of influenza rhinitis? First, we have lower respiratory tract infections, and lower respiratory tract infection lead to the development of pneumonia, and in extreme cases which are not treated for the very long time lead to something known as the encephalitis. So again, it's an viral pathology. So we will give symptomatic management, but to prevent, contain the secondary bacterial infections, we give antibiotic cover to the patient. So this was all about the influenza rhinitis. Now let's move ahead with diphtheritic rhinitis. As the name suggests, the agent of diphtheritic rhinitis is Corynebacterium diphtheriae. So what is the pathology of diphtheritic rhinitis? This bacteria produces membrane over inferior turbinate or a membrane over floor or septum of the nasal cavity. As you guys could see in this image, the whole of the nasal cavity is covered by a whitish grayish pseudo membrane produced by Corynebacterium diphtheriae. Now, general clinical features include fever, malaise, joint pain, etc., which are similar to the general features of influenza rhinitis. Local manifestation include nasal obstruction as well as foul smelling discharge because of the presence of membrane. There is no foul smelling discharge in influenza rhinitis. Treatment is very important in the case of diphtheric rhinitis. First of all, we will isolate the patient as soon as diagnosis of diphtheric rhinitis has been made, because diphtheric rhinitis is transmitted via droplet infection. All right. Next, we will give anti-diphtheric serum to the patient, and we also give antibiotic cover to the patient. So this was diphtheritic rhinitis. Next, we'll move towards chronic rhinitis. Chronic rhinitis is of 5 types. First, we have chronic simple rhinitis. Then we have hypertrophic rhinitis, or sometimes referred to as chronic hypertrophic rhinitis. And most important of them all is atrophic rhinitis, most important one. We have something known as rhinitis sicca as well as rhinitis caseosa. So all 5 of these will be dealt in detail. Okay, let's start with the chronic simple rhinitis. So what causes chronic simple rhinitis is recurrent attacks of acute rhinitis. So it is basically an acute rhinitis which has not been treated for a very long time. Okay, so there has to be some kind of predisposing factor for leading to chronicity of the infection. So the predisposing factors leading to formation of chronic simple rhinitis are: first of all, we have persistence of any sort of nasal infection. For example, long-term sinusitis, long-term untreated tonsillitis will lead to the formation of chronic simple rhinitis. Next, we have nasal obstruction, specifically long-term nasal obstruction, which is seen in the cases of deviated nasal septum and other causes. Then we have chronic irritation, any working condition, environmental condition. If the patient has to work in dust, smoke, or is an avid smoker, then it increases the chance of development of chronic simple rhinitis. Next, we have if the patient has any sort of immunocompromised state in the body, he is taking sort of drug, which becomes an important predisposing factor to chronic simple rhinitis. We have something known as the vasomotor rhinitis, and we also see chronic simple rhinitis in cases of endocrinal disturbances and other metabolic factors. All right, now these were all the predisposing factors and definition of chronic simple rhinitis. Now let's move to the pathology. What happens? First is chronic hyperemia, that is, chronically there is increased perfusion. Now this leads to engorgement of cavernous spaces. Again, blood is collected in those cavernous spaces, and finally, due to chronic nature of the disease, there is loss of cilia and mucus producing cell known as the goblet cells. Okay, so this was the pathology and increase of intensity of the pathology. Let's discuss the signs and symptoms of chronic simple rhinitis. So symptoms include bilateral nasal obstruction. Easy to remember, there is bilateral nasal obstruction, there is nasal discharge because of chronic hyperemia and engorgement of cavernous spaces. Then we have headache, and due to nerve irritation, we might as well see anosmia in the patient of chronic simple rhinitis. So these were the symptoms. Next, we have signs. Signs are important. First of all, we will see nasal discharge. It becomes both sign as well as a symptom. On anterior rhinoscopy, we are going to see pale or congested mucosa. Next, we will see shiny and enlarged middle turbinate. Middle turbinate, there is some sort of enlargement in the middle turbinate because of chronic inflammation. When something is when the middle turbinate we say is shiny, it means the damage is still reversible. It is reversible in nature. If it is not shiny in nature and it is enlarged, then it is permanent. Whereas if it is shiny and it is enlarged, then the condition is somewhat reversible in nature. And finally, we are going to see pinkish, shiny, hypertrophied inferior turbinate as well. Okay, so signs include nasal discharge, pale congested mucosa, and shiny enlarged middle turbinate, which is reversible because it is shiny. Pinkish, shiny, hypertrophied inferior turbinate. What is the treatment? We give antibiotic and analgesics for around 5 days in the patient of chronic simple rhinitis, and we will also do correction of any underlying disease. like endocrinal problems, and we will remove the patient from source of dust, smoking, etc. Now let's move towards chronic hypertrophic rhinitis. So chronic hypertrophic rhinitis is nothing but chronic simple rhinitis for a very long time. So chronic simple rhinitis converts into chronic hypertrophic rhinitis after a very long time. So what is the pathology of chronic hypertrophic rhinitis? See, pathologies of all rhinitis are very, very important, because pathology of all this rhinitis becomes the deciding factor for signs and symptoms. All right. First, we are going to be having permanent hypertrophic changes. See, I'm talking that in chronic hypertrophic rhinitis, there are permanent hypertrophic changes, but we see hypertrophy in simple rhinitis as well, but it is reversible in nature. We say this is reversible because the mucosa is still shiny in nature. Okay, then we are going to see thick nodular mucosa, which is not shiny anymore. Then we will see excessive fibrosis in the nasal cavity. So now let's discuss the symptoms and signs of chronic hypertrophic rhinitis. There is going to be excessive nasal secretion. There is going to be nasal obstruction, which typically the patient would present to you like, he would say the nasal obstruction worsens at night. The patient will breathe from mouth. There's going to be voice change due to rhinolalia closa, and finally the patient will complain of frequent hawking, that he will say that he's clearing his throat more often. All right. In signs, we will perform anterior rhinoscopy, and on anterior rhinoscopy, what things we will see are, there's going to be dull pink swelling. It is not shiny anymore, of anterior end of inferior turbinate. Again, I've mentioned shine is lost. That means this dull pink swelling, this hypertrophy is now permanent. All right. If we have to reverse this condition, we might have to cut the excessive swelling. Next, we have diffuse hypertrophy of turbinates. We see very, very important point here. Mulberry-like enlargement of inferior turbinate. See, I have mentioned inferior turbinate so many times. Inferior turbinate, mulberry-like enlargement. Therefore, it is noted that in chronic hypertrophic rhinitis, maximum changes occur in the inferior turbinate. All right. Now let's see the signs with the help of these diagrams. I have mentioned that inferior turbinate shows mulberry-like enlargement. See, this is the fruit, mulberry fruit. See these small bumps all around its surface, and similar to these, we see on the surface of inferior turbinate. See this mulberry-like appearance, mulberry-like enlargement of inferior turbinate, and in this image as well. All right. So this is the buzzword of chronic hypertrophic rhinitis, that is mulberry-like enlargement. Okay. So there is, it is not, mulberry-like enlargement is not specific to inferior turbinate only. Mulberry-like enlargement is not just associated with chronic hypertrophic rhinitis. So this is the differential diagnosis of mulberry-like turbinates. Of course, we have studied mulberry-like turbinate in chronic hypertrophic rhinitis. It is also seen in the cases of allergic rhinitis, rhinitis medicamentosa, and non-allergic rhinitis plus eosinophilic syndrome. So you guys have to remember all four of these in which we see mulberry-like turbinates. Allergic rhinitis, chronic hypertrophic rhinitis, rhinitis medicamentosa, and non-allergic rhinitis with eosinophilic syndrome. Now let's see the treatment of chronic hypertrophic rhinitis. So first we have to discover the cause and treat it accordingly. Then, since the hypertrophy is permanent, so we have to reduce the size of turbinates by surgical intervention. So how we are going to decrease the size of turbinates? By the means of the following methods. First, we might do something known as the linear cauterization of turbinates. We might as well do some mucosal diathermy, cryosurgery, and we might as well do partial or total turbinectomy in order to improve the obstructive nature of the nasal cavity. So the management include reduction in size of turbinate, since increase in size of turbinate is permanent now. So partial and total turbinectomy is to be done. Now, the most important topic of this video is atrophic rhinitis. It is asked in almost every university exams, and MCQs of this topic are important as well. Now let's start with the definition of atrophic rhinitis. All right. So atrophic rhinitis is a chronic condition of nasal mucosa. So it affects the nasal mucosa, leading to the atrophy of nasal mucosa. So we see atrophy at nasal mucosa, we see atrophy of turbinates, we see atrophy of nerves, we see atrophy of glands. And this is all because of two conditions: endarteritis or periarteritis of vessels supplying the nasal mucosa. Okay, atrophic rhinitis is characterized by very important. All these three terms are highly important. That is roomy nasal cavity. Roomy nasal cavity. We see greenish yellow crustaceans in the nasal cavity and a characteristic odor referred to as ozena. Alright. Atrophic rhinitis is sometimes referred to as ozena as well. So these two words are used interchangeably. Ozena and atrophic rhinitis. So let me repeat the definition once again. Atrophic rhinitis is a chronic condition of nasal mucosa in which we see atrophy of nasal mucosa, atrophy of turbinates, nerves and glands. It is all because of endarteritis or periarteritis. And atrophic rhinitis is characterized by roomy nasal cavity, greenish yellow crust and a foul smelling smell known as ozena. Alright, atrophic rhinitis also referred to as ozena. Okay, atrophic rhinitis might occur in all ages 2 to 80 years of age, but the buzzword is going to be atrophic rhinitis is more common in females, and especially atrophic rhinitis starts around puberty. So this particular line would always be in a question of atrophic rhinitis. That is, a female presents to you in age of puberty with the following symptoms. Alright, so it's going to be atrophic rhinitis. So let's see what are the types of atrophic rhinitis. Atrophic rhinitis is of two types. We have primary atrophic rhinitis and we have secondary atrophic rhinitis. So primary atrophic rhinitis is further of two types, type 1 and type 2. Pay attention to this flowchart, it is very important. In type 1, histologically there is endarteritis or periarteritis, whereas in type 2 primary there is vasodilatation of capillaries. Okay, if we give estrogen therapy in the cases of primary atrophic rhinitis, if there is improvement in symptoms, it is type 1. If the symptoms worsen, it is type 2. Since estrogen therapy leads to vasodilatory effect, and already in type 2 there is excessive vasodilation of capillaries. So due to estrogen therapy in type 2 primary atrophic rhinitis, it will lead to worsening of the sign and symptoms. All right. So let me repeat this again. Atrophic rhinitis of two type, primary and secondary. Primary is further of two type on the basis of histology. In type 1 we see endarteritis and periarteritis. In type 2 primary we see vasodilation of capillaries. And on giving estrogen therapy and its vasodilatory effect, in type 1 there is ease of symptoms, signs and symptoms, whereas in type 2 signs and symptom worsens due to vasodilatory effect. Now what are the causes of secondary atrophic rhinitis? Most common cause is secondary atrophic rhinitis is surgical intervention. Alright, that is iatrogenic cause. Other causes include leprosy, syphilis, tuberculosis, rhinoscleroma, nasal myiasis, and radiation. Leprosy, syphilis, TB, and rhinoscleroma are chronic granulomatous infections. Okay. And now let's see what are the causes of primary. Primary atrophic rhinitis is more important. So the cause of primary atrophic rhinitis could be remembered by a simple mnemonic, that is hernia. HERNIA. So with H we see that atrophic rhinitis is hereditary in nature and it is of autosomal inheritance, autosomal dominant inheritance. From E we see endocrinal imbalance and estrogen deficiency. That's why it is more common in females. R is racial, it has some racial preponderance. Nutrition, N for nutrition, that is it increases in patient having deficiency of vitamin A, deficiency of vitamin D and iron. For E we have infection, so there is a bacteria known as Klebsiella ozeni and the atrophic rhinitis is also referred to as ozena. So therefore the infection of Klebsiella ozeni leads to atrophic rhinitis. It is also referred to as Perez bacilli. So both of those names can be used interchangeably. For E, we have autoimmune diseases. Any disease in which there is excessive secretion of IgM antibody, it would be leading to increased chances of atrophic rhinitis. So we have covered the causes of primary as well as secondary atrophic rhinitis. Just remember the word hernia and you are good to go. Hernia is hereditary, endocrinal imbalance, racial, nutrition, infection, and autoimmune diseases. So, all these are causes of atrophic rhinitis, which is going to be bilateral. Okay, atrophic rhinitis is a bilateral condition, but most common cause of unilateral atrophic rhinitis is impacted deviated nasal septum. It's a potential MCQ. Since all of these causes lead to bilaterality of atrophic rhinitis, most common cause of unilateral atrophic rhinitis is impacted deviated nasal septum. Alright, now let's discuss another important part, that is the pathology of atrophic rhinitis. So as soon as the patient starts to develop sign and symptom, it is because of the following three changes. First, we have epithelial changes, then we are going to be having vascular changes, and finally we are going to see bony changes. Alright, let's start with the epithelial changes. In epithelium changes, there are squamous metaplasia. What is metaplasia? In which one fully developed skin layer changes into another fully developed skin layer. And in condition of atrophic rhinitis, ciliated columnar epithelium changes into stratified squamous epithelium. Okay, so this is the change. First epithelial change. Then we are going to see atrophy of glands and atrophy of nerves. Because of atrophy of nerves, the patient is going to see condition known as anosmia, because atrophy of nerve also affect the olfactory bulb of the patient. Okay, there is going to be loss of cilia in epithelial changes as well, because ciliated columnar epithelium is changing into stratified squamous epithelium, so cilia is lost as well. In vascular changes, what we are going to see is dilated capillaries in type 2, we have already discussed, and endarteritis and periarteritis in type 1 primary atrophic rhinitis. So you guys already know this part. In bony changes, there is going to be bony resorption. This bony resorption is so much so that the turbinates are reduced to mere ridges. So they turbinates become so small and petite that they appear to just like small ridges in the nasal cavity. And because of bony resorption, there is increased serum alkaline phosphatase. So pathology include epithelial changes, vascular changes, and bony changes. All the following points are highly important and you have to remember everything by heart. Now, this histology is not important from ENT point of view, but I have added this to show the extent of formation of stratified squamous epithelium in this slide, this is referred to as squamous metaplasia, all right, in which the stratified squamous epithelium replaces the already present ciliated columnar epithelium. Okay, now let's move to the another important section, that is signs and symptoms of atrophic rhinitis. So, patients of atrophic rhinitis suffer from something known as merciful anosmia. So, the concept is the anaerobic flora present in the nasal cavity. The anaerobic flora present in the nasal cavity produce offensive smell. Okay, this offensive smell is perceived by person surrounding the patient, all right, but the patient is itself unaware of this bad smell because the person is anasomic. He cannot differentiate between smells because there is atrophy of nerves. So the patient does not know any type of bad smell is coming from his nose, whereas the person vicinity of this patient might smell and get offended by the smell, all right. So along with merciful anosmia, we have something known as thick crusting and discharge from the nasal cavity, and when we remove this crust from the nasal cavity, there is bleeding, and this bleeding is referred to as epistaxis. Epistaxis occur after removing crustaceans in the nasal cavity. There is going to be nasal obstruction, but initially I have mentioned the characteristic of atrophic rhinitis that the nostrils or nasal cavity are roomy. But why is there obstruction? Obstruction is because, see, these are roomy nasal cavity and these are filled with crustacean, formation of crust, and this decreases the lumen of nasal cavity. Although the nasal cavity is roomy because the bones have resorbed and other changes as well, but there is excessive crustacean there, that this is known as paradoxical nasal obstruction. And finally, the patient is going to experience foreign body sensation in nose and dryness of throat as well. Now, this was all symptoms. Just remember merciful anosmia, paradoxical nasal obstruction, and when we remove these crusts, there is epistaxis. Now let's move to the signs of atrophic rhinitis. So generally we see general sign include presence of bad smelling odor, that is referred to as fetor or ozena. On anterior rhinoscopy, the following things are seen. First, we see roomy nostrils. In this cavity, you guys could easily appreciate that how roomy the nasal cavity has become. So on anterior rhinoscopy, the first thing to be seen is roomy nostrils. And the second thing we see is yellowish, greenish crust, all right, and when we remove this crust, they bleed profusely, leading to epistaxis. So they bleed on removing the crusts. And finally we see dryness plus turbinate atrophy. Okay, on anterior rhinoscopy, what do we see? We see roomy nostrils. You guys could appreciate in this diagram. We see right here yellow, blackish, greenish crustaceans in the nasal cavity which bleed on removing. And finally, we see drying as well as atrophy of turbinates. The turbinates become mere ridges in the nasal cavity. All right. Now, on posterior rhinoscopy, what do we see? On posterior rhinoscopy, crust filling the nasopharynx. We see crust filling the nasopharynx, and the amount of crust becomes so much that they may even coat the posterior pharyngeal wall. Alright, this is seen on posterior rhinoscopy. Otherwise, finding of anterior rhinoscopy are much more important than finding of posterior rhinoscopy. Now, treatment is very, very important. So, first thing let me mention is there is no specific treatment regimen for atrophic rhinitis. It's all mix and match of various procedures and various medical or surgical interventions. So, treatment is of two types. First, we have medical treatment, and finally, we do surgical procedure if it is not treated by medical procedures. All right, first line is medical always. So medical treatment, just remember the mnemonic dog park. DOGPARK. So the various regimens include nasal douching. With D, with O we have estrogen therapy. With G we have glucose in glycerin nasal drops. P we have placental extract placement in the nasal cavity. With EA we have autogenous vaccines. We also have acetylcholine. With R we have rifampicin 600 mg once daily for around 12 weeks. And with K we have chemacetine. All these things have to be tried individually. They are not given, everything is not given at one time. All right, in surgical the most important part is Young's operation. This is the only one we have to study. Otherwise you might as well remember the names if you want to. Otherwise knowing Young's operation is sufficient. So the mnemonic is young lady was simply very superb. Young lady was simply very superb. So the name of operation include Young operation. It is the most important one. We have with L we have Lawton Slager's operation. W we have Wilson's operation. With S we have stellate ganglion block. V we have vestibulopathy. S we have salivary duct transposition, referred to as Whitmack's operation. Just remember Young's operation and you are good to go. Now let's study the medical management in a bit detail. Alright. First medical management is nasal douching. Alright. So what is nasal douching? How do we define nasal douching? It is the irrigation of nasal cavity. How many times? We irrigate the nasal cavity 3 times a day using what? We use this solution. 2% alkaline solution mixed in 280 ml water. Repeat after me. We use 2% alkaline solution in 280 ml water and we irrigate the nose with this 3 times a day. What are the components of this alkaline solution? One part we have sodium bicarbonate, one part again we have sodium biborate, and 2 parts of sodium chloride we use. Alright, what does sodium bicarbonate does in the nasal cavity? It produces alkalinity in the nasal cavity and it produces effervescence, which removes the crust. Okay, so and what does sodium biborate does? It leads to antiseptic action. Sodium chloride is nothing but acts as a vehicle of carrying these two chemicals. Now let's see other two medical management, that is glucose in glycerin nasal drops. So we mix glucose and glycerin. What amount of glucose and what amount of glycerin? We take 8 gram of glucose and 30 cc of glycerin and we mix them together to form nasal drops. And what does glucose do? Glucose is bacteriostatic and it conversion of glucose into lactic acid creates acidic pH, which is unfavorable for growth of bacteria. Alright, what does glycerin do? Glycerin first of all moistens the area. Glycerin is hygroscopic. It collects moisture from the environment. Glycerin also slightly increases the vascularity of the nasal cavity. And finally, we might as well try something known as the chemacetine suspension. Chemacetine suspension contains antibiotic chloramphenicol. We also have estradiol, vitamin D2 and propylene glycol. So all these three are individual medical management. If atrophic rhinitis is not treated by medical management, we move towards the surgical procedure. And the most frequently done and important surgical process is Young's operation. So how do we define Young's operation? We simply surgically close the nostrils. We close the nostrils in Young's operation for about 6 months to 1 year. How do we do it? We do it by raising the flaps and suturing them together. So let's see the mechanism. We close the nostril uh, to produce hypercapnia, increase CO2 concentration in the nasal cavity. This hypercapnia reverses or reverts the squamous metaplasia back to ciliated columnar epithelium. Okay. In atrophic rhinitis, ciliated columnar epithelium was changing into squamous epithelium, and this hypercapnia, increased CO2 concentration because of Young operation, reverses this pathology back to normal. But nowadays, we don't prefer the Young's operation. We prefer something referred to as the modified Young operation. What is the difference between Young's operation and modified Young's operation? So this is the difference. In Young's operation, we by the means of suturing and raising flaps, we close the entire nostril. Whereas in modified Young operation, a central opening of around 3 mm size is maintained by keeping a polythene tube during suturing the flaps. So the only difference between modified and old Young's operation is that in modified Young operation, we leave some space for breathing, around 3 mm size, using a polythene tube when we are suturing the flaps. So these are the points which prove that why modified Young operation is preferred than normal Young's operation. So these are some important points. First, both sides can be done at the same time in modified Young operation, whereas in Young's operation, first initially we close the right side or the left side, and finally after 6 months to 1 year we close the another one. So the timing to treat the disease is very long. Whereas in modified Young operation, we simply close both the nasal cavity for 6 months to 1 year. The next important point in modified Young operation is satisfaction of nasal breathing. There is no nasal breathing in Young's operation, whereas because of this 3 to 4 mm space, patient has a satisfaction of nasal breathing. There is no rhinolalia clausa in modified Young operation. The ENT specialist can perform ENT rhinoscopy as well. There is no question of anterior rhinoscopy in Young's operation. And along with all this, modified Young's operation is cosmetically better, and it gives better functional results because it is much more tolerated. So this was all about the management of atrophic rhinitis. Each and every single point is highly important. Okay, let's move to the remaining two very small topics in chronic rhinitis. First, we have rhinitis sicca. Sicca, as the word suggests, it means dry nature. By going by the definition, rhinitis sicca is a drying condition of the nasal cavity. Okay, it is associated with dirty black crustaceans in anterior nasal cavity. And the buzzword of rhinitis sicca is it occurs in persons which are exposed to dry and dusty environment. So this is the buzzword for rhinitis sicca. So the patient presents works in dry and dusty environment and has dirty black crustaceans. What are the signs and symptoms? Symptoms include nasal obstruction, discharge of crust, irritation, and epistaxis, which are somewhat similar to atrophic rhinitis. Alright. Signs include dry mucosa, black crustacean, perforation of septum, and ulceration in the anterior part of nasal cavity. Alright. So these are the signs and symptoms of rhinitis sicca. What is the treatment regimen? First of all, since it is occurring in a dry and dusty environment, we will change this environment of the person. We will suggest him to work in different environment. Alkaline douching 3 times a day, similar to atrophic rhinitis. 25% glucose in glycerin nasal drops, again similar to atrophic rhinitis. So this was the treatment regimen for rhinitis sicca. Next, we have something known as rhinitis caseosa. So rhinitis caseosa is also referred to as nasal cholecystoma. It is another important MCQ. So nasal cholecystoma is nothing but rhinitis caseosa. Going by the definition, rhinitis caseosa is nothing but chronic inflammatory condition of the nose which occurs due to obstruction of nasal passage. So there is obstruction of nasal passage, there is obstruction of sinuses because of any stenosis, because of any adhesion, or because of any synecdoche. So what is the pathology of rhinitis caseosa? There is stenosis, there is adhesion, or there is synecdoche. This leads to constant exfoliation of mucosa and its retention in the nasal cavity because there is stenosis, the nasal cavity is obstructed. There is long-term debris collection in nasal cavity, and with this long-term collection there is going to be chemical and mechanical changes around the debris, and which lead to putrefaction. This putrefaction leads to foul smelling odor. Finally, a gaseous material results in the nasal cavity. I have added the image. So this right here is the white cheesy material, gaseous material that is collected in the nasal cavity. Now let's discuss the signs, symptoms and treatment of rhinitis caseosa. Symptoms include nasal obstruction, of course, because of this cheesy material. We will see anosmia due to damage to olfactory bulb and other nerves. We will see offensive odor because of putrefaction of the cheesy material. Signs include, as you guys could see in this image, presence of cheesy material. Sometime in long-standing caseous rhinitis caseosa, there is septal perforation as well. We see ulceration and finally bony destruction in later stages. What is the treatment regimen? First of all, we will simply scoop the cheesy material out. First is removal of cheesy material which is leading to putrefaction and bad smelling. We will scoop it out. Then we will do alkaline douching 3 times a day for around 3 weeks, similar to atrophic rhinitis. And we will give antibiotic cover to prevent secondary bacterial infections. Alright, so guys, we have covered every single thing in this. So if you liked my video, please subscribe, share, and thank you.